I've had chronic tension headaches at the base of my head, and when they get really bad, right behind my right eye. Since I was 15 or 16, I had, and that's pretty much every day, you know, a chronic kind of thing that affected every aspect of my life, schoolwork. Ended up finishing at a kind of alternative high school, but managed to kind of push my way through college and into professional life. 2 months ago, I am in the middle of meditating, trying to reduce stress and to therefore reduce the pain and the tension in the muscles in the head and the neck and the shoulders, and I feel this tingling sensation. Just like I'd felt at physical therapists when they put the electrodes on one end and the other of a certain muscle in your neck or shoulder. And the muscle in my neck, I was laying on the bed, in my head, you know, I'm meditating, so I'm just observing. I'm not judging. These things are happening. My body is doing this. I'm just letting it. And by itself, it just starts going straight back up until I'm looking at the ceiling, and then soon enough, I'm looking at the wall, just like behind my head, not just the ceiling, so I try to move my head, but I can't. And so that's when the weirdness started to come, and I talked to my general practitioner. He's like, I don't know, because I did a bunch of research. I'm like, maybe this is dystonia, because it kept happening over and over. The shoulder group, muscle groups kept getting involved. I would kind of do this, maybe a little bit of a tremor back and forth, and all the videos I found online and information online look like cervical dystonia, but my general practitioner said, no, dystonia is, you know, it's when you take some antipsychotic medication, so it's, you know, probably just, you know, tell me how you feel in a few days. He gave me some Flexeril, which just relaxed all the muscles, but the spasms still happened, and then my shoulders were bouncing, the tremors were a lot more prominent. So I booked the first new patient neurologist I could, and about a week later was able to get a diagnosis of cervical dystonia, and he gave me a 2 milligram Klonopin, clonazepam, 3 times a day as needed, kind of, and that has helped a lot. But I've been just on short-term work disability just because of the pain and the constant spasming, yes, and then I found out about there may be a connection with the TMJ. I don't know how much you want me to. Do you want me to just go straight into that, or?
Yeah.
Okay, so I was actually born really close to here. Like both my parents grew up in Burbank. I was born in Glendale Hospital. My wife and I grew up in San Diego, but we now live in the Bay Area. I work in tech. And so I heard about Dr. Demerjian from his website online, from YouTube videos, like this is one of, and so visiting my mom, who's down in Carlsbad, Southern California, you know, made it an excuse to go check out this guy and see if he's for real. I was very impressed initially, but you know, skeptical as I usually am. My neurologist kind of brushed it off that, you know, there's no TMJ connection. Up until that point, I had not seen a TMJ specialist, but I had definitely had jaw problems, and during my teen years, over the course of 7, 8 years, I think it was very extended because of my inability to attend the appointments because of the neck pain and the head pain. But orthodontics treatments through 2 orthodontists, and what they did when I was 17 or 18 was actually my left side of the teeth wouldn't touch when I would close my mouth, so they used rubber bands on the outside of all the teeth on the left side, and then from the outside to the inside of the lower teeth as well, so pulling down and this way. And so since then I've had, you know, intermittent jaw pain, you know, not loud clicking that I can notice, but it tended to be worse around the same times that my tension headaches, especially the really bad ones when the eye was involved. Everything around the face and the jaw and the neck would all be going off at once. And so I was, I mean, initially seen for TMJ disorder. It was pretty clear that I had it, you know, due to the thorough exam, and then for the dystonia, a specific mouth guard was made, and we've been testing it over the last 45 minutes, and it's been able to stop every spasm that I've had so far, and that's awesome.
Okay, I want you to bite on your back teeth.
Okay.
Bite, chomp, chomp, squeeze on your back teeth, on your molars.
Uh-huh. And here's one coming. So, everything just involuntarily pinching back.
I'm going to swing this over and
Sure.
you can grab the mouthpiece right there on the tray. Bite down, close, tap, tap, tap on that, and just rest.
I feel like I'm on an infomercial. So, life-changing. That's after just 2 months. You know, it hurts to think about all the other dystonia patients who haven't seen or experienced what I just did, you know, for decades even. So I'm grateful that I've only suffered with it for a couple months, but I'm glad that I found this relief.